Hello, this is ECTS 504, Week 1, Assignment 1 for Dr. Andrew Hughes. Today we are going to be talking about career technical education in a few different realms. One being the significance of career technical ed on a few different impacts it has on students. Secondly, we'll talk about local, state, and federal structures that we have set in place and how that impacts us and as well as the students. We'll also talk about how those structures impact me professionally, not only as a teacher, but how I feel they impact my profession of athletic training as well. Lastly, not lastly, we'll talk about career pathway opportunities and decisions and how kids go about looking at those and how the educator's role in that incident, I guess, for lack of a better term at the moment. And lastly, we'll talk about recruitment, how we are recruiting students into our CTE programs and some things that we do. With that being said, I would like to go ahead and start off. There will be glance down at a few notes I have written down, and I will supply those upon submittance of this assignment as well for you to view. First thing I want to talk about is significance of career technical education. One of the biggest impacts where I feel CTE really comes into play is from a economical point of view. Based off some of the information that I've researched, there has been statements from research that say kids are less likely to drop out of high school if they were to take one CTE class per every 2 academic classes. They believe that is not only a change in the flow of their normal academic day, but it also allows for opportunity for good hands-on. Secondly, from an economical standpoint, is funding. Through the Carl Perkins loan, we can do things that normal classes may not have the opportunity to have. If you work in a district with a really low budget, this loan allows for you to go in and get some things. I know for me personally in the past, I've been able to get some modalities that we use in a sports med setting at the collegiate and professional athletic levels that a lot of high schools don't have. Not only has that had an impact on my athletes and my patient care, but it's also awesome to really see high school students get to grasp that technology that most high schools don't have and how we can apply that and watch them really learn how to use it, get their hands on it, get their feet wet a little, so to speak, and really spark their minds to ask further questions. And lastly, from an economic standpoint, one thing I believe CTE is great for is the students who may not be going directly to a junior college or a 4-year school. A lot of them can't afford it financially, and as we hear all the time, prices keep going up. There's scholarships out there, but maybe students aren't really have that opportunity to go out there and get their college paid for. And one thing that's great about CTE is with industry partners, there are certain programs within CTE programs. For example, I'm going to use the automotive industry. My classroom is right next door to our automotive class, and the auto shop kids do a great job of taking certification tests that is going to allow them to earn industry recognized certificates, which allows them to go into the work field almost immediately after graduation. It may not be their main goal position, but it does allow them to go in and get some experience, real life work experience, not only when they're in the classroom, but as soon as they graduate, which is awesome. Now, on the other hand, there is some classes, such as mine. I teach a sports medicine class where we have industry recognized certs, but however, depending on what they want to do, it may just be considered a stepping stone. But which also allows students to get their feet wet and really dive in and get some work experience. So, for example, with athletic training, if you want to become a board certified athletic trainer, you have to go through a 4-year university that's CATIE accredited. That's our accreditation board. Then you sit for your boards exam. And actually, in 2 years, that is changing to a mandated master's degree. So students can still take this class, but they can't go and work as an athletic trainer right after graduation of high school. Also, another big thing from economics is the return the community gets from it. There's multiple communities, and LA County was a huge one, and the research I saw was for the amount of money they put in taxes and everything else, they see about a 10% return from the LA Community College District. And I think that is awesome to see them get a return on what is going out, and then they're actually seeing it come back into the community. So those kids are actually going through programs and coming back to work. Lastly, another big impact career technical education has had is a lot of our industry partners have spoken of the soft skills that our students have, and how great that is to see kids from high school coming in with the soft skills to actually work in the industry. They're learning how to communicate with patients or clients, and they're learning how to communicate with a boss, learning how to fill out a job application, learning how to format a resume, and I think that is fantastic. Moving on, we do have our area CTE that I'm going to talk about, then move on to the state and federal levels. For our area, we are a member of the JPL. It's made up of local area schools. All the CTE teachers, we get together about 3 times throughout the year. We do huge course collaborations. So let's say all the medical teachers get together, then we can have all the automotive or welding or FFA teachers get together. And we really get to go through, take a look at the curriculum. What are things we want to see change? How do we think we can do that? What is best for the kids? What that means for you students is it's constantly evolving to meet your needs and to best prepare you for what is to come in the upcoming years, if you're an underclassman, or when graduation is here. Where do you go next? JPL, we also make we get together and make an effort to do mini competitions. So when you hear of Skills USA, usually you go straight to a regional competition, then state, then national. But we try to do area competitions. One, it helps the kids get acquainted to the process, and really lets them know what to expect, so to speak. Moving on to the state level, I'm going to talk specifically about the healthcare classes at this point. Some state structures that we have CalHOSA is a big one. HOSA stands for Health Occupation Students of America. Obviously, Cal is California. That is huge for us because it's also leading to big events where students are getting to meet and network with other students. A lot of times you hear it's not what you know, it's who you know. And this really gives students an opportunity to get in there and network, meet with some professionals they have never met, work on some new ideas. And the big thing that CalHOSA does every year is something that I take my students to. It's called SLC, Student Leadership Conference. And the state allows them to go. It's usually 3 days, 2 nights. They go and they get to do all sorts of things. There's different events they can compete in, so there's a competitive side to it. Then there's the learning side, where kids have an opportunity to do things that we may not even get to do all the time in the classroom setting. I know I had some students do a suturing lab where they got to learn how to do stitches, and it was an actual orthopedic surgeon that came in and taught the class, and they loved that. Also, moving on to the federal level is the Perkins Grant. The Perkins Grant is huge. I kind of highlighted on that earlier, but it improves the quality of our programs. So it improves what we can do for our students, for you guys. Whether it's better machines, depending on what class it is, bringing in certain things, or as things are changing in the industry, allows us to change as well. So we're not teaching things that are 10 years old when we don't use them anymore. Also, at the federal level, CTE classes, you're starting to see more and more they're becoming, the curriculum is aligned with junior colleges. So those units are transferring over. And we're seeing nationally recognized CTE programs such as HOSA really take off. And not just for the students, but it's great for me, the instructor, to talk to other instructors throughout the country when we go to these events, and see what they're doing, because we're constantly changing to see what we can do to make it best for our kids. Biggest impact, kind of talked about how this impacts the students, but for me, a lot of times I get caught in between being a teacher and being an athletic trainer. Um, it is a battle that I fight often. Not that it's a negative battle, um, but it does have an impact on me when I currently have 60 students. So I have 60 of you guys, and there's one me. The way it is with my boards, my certification, I should say, my board does not allow me to send students anywhere unsupervised, because essentially you guys are working under my certification. So if I were to send a student and they were to do something that causes harm to a student athlete, that comes back on me. And also there's times when I am mandated to go to certain trainings, by the district, and they're usually not one day, they're usually week-long events I need to go to for my continuing ed. Um, and so that has an impact on my students. There's times when I'm not in class or I have to leave early because we have an away game. And what's great about CTE is you work together with such a close-knit group of people. I have teachers that regularly volunteer to, oh yeah, I can take over your class, and they know exactly what to expect from my kids, and vice versa. You students know what to expect from them. Um, and another thing that is great about CTE programs are the teachers work so close together. It's not having someone coming who has no idea what's going on. You're going to get someone that can help you even when your main teacher may not be available right that minute or that day. Moving on, talking about career pathway decisions. One of the biggest things that I face with this class is kids want to know about a lot of different careers. I'm in a very fortunate, sorry, not unfortunate, position where it's not just me working. I work with a handful of allied healthcare professionals, which has allowed me to build a fantastic network from any sort of healthcare professional for the most part. If there's something that a student wants to know more about, let's say physical therapy, I have multiple physical therapist contacts I can have come in and do guest speakers, or students have questions about, okay, well, I want to be an EMT, how do I do that? We talk about the different career paths. And you'll hear me in my classes, we talk a lot about the sports medicine team because they all work together. So we often are looking at multiple career paths, and how they are different from each other, yet so there is some similarities. Another big, excuse me, another big great thing we have is our community partners, our industry partners. I like to say community partners because I'm in a small community, and we work together often, not just for CTE purposes, but for healthcare purposes. And we do outreach, which I'll get to here in a few minutes. But our community partners are always willing to come in and be guest speakers about what they do. How is it different from my job, or how is it similar to my job? As well as they often open up shadowing opportunities for our students, which has been fantastic. We've had students that shadow chiropractors, physical therapists. We've had students do ride-alongs with the fire department. Usually they have to set some of those up on their own, but we are able to provide the contact info to them. Lastly, one of the biggest things that I feel a lot of programs struggle with is recruitment. Lucky for me, I walked in to a school that is great at recruitment. We have what we call a MAST Academy. It is medical and health science technology academy. It is a part of HOSA, Cal HOSA. And what they do is for the first 2 years, it's a general schedule laid out. This is the classes you take, and they basically get an intro to health careers. And then they reach a point where they can go a few different ways, um, which one of them being sports med. So I get a lot of those students. The great thing about my class is it's not only for masked kids, it is for kids not associated with that program as well. So I get a good mix. But ways that we have done successful recruitment has been recruitment fairs, community outreach. We do a program called Health Strong where we work with a local chiropractor, where some of my students actually go and help run. Um, it's kind of, how do I put this? It's like an intro to a healthy lifestyle for elementary kids, and they teach them about healthy snacks, how exercise can be fun. It doesn't have to be something such as running, and that's it. They teach them how we can play certain games. And back to the recruitment fairs, we'll go visit our feeder schools, and we have posters made by our students about things they've done throughout the year, or we'll even bring some of our students along with us. Or we also host a feature high school night, where parents have the opportunity to come up and ask questions about our program, about what is different from this program, how does sports med differ from medical assisting, things like that. And it's a great opportunity. That pretty much concludes this for today. Thank you.